Hi, my name is Stephanie Mitchell. I'm here with my friend Katie Hunking. She has so graciously agreed to talk with us today and share about her mental health journey. So I'm going to go ahead and let her introduce herself and tell us why she's here.
Um, I am 25 and currently I own my own business. It's pretty exciting. In my mental health journey, have been, trying to figure it out since I was about 11. So my diagnoses are ADHD and PTSD. And my PTSD tends to kind of show as like anxiety and depression. So,
Okay. Well, thank you so much for sharing that with us. And so I was just wondering, do you want to expand a little bit more on those diagnoses that you do have? It sounds like they're a little bit complex, at least one of them.
yeah. So PTSD is usually classified based on the way that it affects you. So, usually you have two or three major symptoms that your mental health provider is attempting to help you resolve. And I have regular PTSD, not complex PTSD, which means I have three major, what are considered traumatic events in my life. My first one was being assaulted when I was 11. My second one was having an abusive boyfriend when I was in college. And my third was being in an explosion. So all of my anxiety and depression are related to those events and are triggered by things that happen from those events. So really, my anxiety gets much worse when I hear loud noises that I can't exactly identify where they're coming from. My gets a lot worse when it gets really cold outside because that reminds me of my time being assaulted. So it's one of those things.
Well, I'm so sorry to hear about those things. So, but thank you for being so vulnerable to share. I think that helps other people who are going through things like that to not feel so alone. So,
Absolutely. I think the more that people can learn about other people and the more we can connect with each other, the more of a structure we'll have for our support.
I agree. So, my next question for you, what do you do to take care of yourself physically when you're having a difficult time with your mental health?
Absolutely. Like I said, cold can kind of affect me and that can really get my depression going. So I keep my house cranked up. It's always about 70 degrees. People will come in and they'll start telling me, wow, it's so warm in here. Um, yeah, I love to keep blankets around everywhere. I have probably four or five on each couch in my house. I keep like four or five on my bed. I love to have heated blankets kind of tossed everywhere. And it's taken me a lot of years to figure out what exactly it is that gets to me and bugs me. But I also like to keep just a consistent schedule with my sleep schedule. With depression and anxiety, sleep can be a huge struggle. And so I found that doing just things that help me focus myself right before bed is one of the biggest things that I can do. And so I have like a long skincare routine and I do that every single night. And that just kind of gives me time to self meditate on my day and kind of remember the really good things that happened that day and just take a moment to take a deep breath and calm down right before the end of my day.
That's really good. I also struggle with anxiety and sometimes depression. My depression is a little bit better this year with the new medication that I'm on, but I
Oh,
know
that's
how
so
much.
exciting.
Yeah, thank you. I know how much those things can affect sleep, and sleep is so important. And like, we don't realize how important it is until we don't have a good schedule with it. So it sounds like you have a great routine for that. And then I can, um, I can relate to wanting to be warm. Just I'm cold all the time, so Sounds awesome with all the heated blankets and the cozy stuff. That's really good. I'm glad that you figured out stuff to make you safe. I think that's really important to make you feel safe and everything. So I wanted to ask you, what is it like to find the right medication for your mental health diagnoses? I know that I have had a struggle for a long time, and I did find one that helps with my depression, but I'm still looking for one that helps with anxiety. And I was just wondering if you could share your experience about that.
Absolutely. I think that is one of the biggest struggles that anyone can have with mental health. Finding the right medication is so hard. I have been trying different medications really since I was 11. I've been on and off different depression medications. And sadly, having ADHD and anxiety, sometimes uh, ADHD medication can really affect your anxiety negatively, and it can be difficult to be on both of those things. Um, so currently, I don't really take anxiety medication. I take a panic attack reactive, so I take lorazepam when I have like a severe panic attack and I need something to help me come back. But other than that, I take a tricyclic depressive antidepressant, which almost are not used anymore. When I go see a new doctor, they always ask me how to pronounce the name of it. I take disipramine. And basically, I went through the whole gambit of SSRIs and wasn't really finding anything that was working for me personally. I was just kind of upping the dosage and upping the dosage and not feeling any of the benefits. And so eventually, my psychiatrist kind of was like, let's try something old fashioned. And tricyclics are kind of the original antidepressants. We got away from them because some people have pretty severe side effects with them. I haven't noticed any of those side effects, except when trying to get off of the medication. I have been on disipramine for 5 years now. I've only had to get off of it twice, and both times you deal with some auditory hallucinations while trying to get fully off of them. But I was able to get right back on them, and I really appreciate them because they help me so much, and I'm able to up my dosage in the winter, go back to a lower dosage in the summer, and really have no struggle. And that has been so relieving. That has really changed my life. And it has been amazing coming to that conclusion.
That's really good. I know that feeling of finding the right medication finally, and it's like, oh, so this is what it feels like to have a normal, happy life, right?
Yeah,
You don't know. But yeah, yeah, I can relate to that piece about the SSRIs. I don't seem to respond well to those,
yeah,
and being anxiety and bipolar depression, it's kind of like it's hard to find one that works for anxiety and doesn't make your depression worse and things like that. So I'm still on that journey. I'm willing to keep trying stuff. So I have
yeah.
hope that something.
I think personally, I really like to go for my anxiety. I like to look at more like grounding ways to be able to deal with my anxiety. For me, my depression is much worse than my anxiety. My anxiety is pretty mild. So I have a lot of fidget toys and do a lot of things with like slime and textured sand. And when I get really anxious, I like to just take 5 minutes. They're all scattered throughout my house. I think I have like 6 things of Play-Doh randomly placed throughout my house. And anytime I get too anxious, I'll just like grab the nearest thing and just spend like 5 minutes kind of just collecting myself. And that's kind of what I chose to do instead of looking for those medications because of that struggle with those conflicting diagnoses and those conflicting medications.
That's such a good idea. I love that something so simple as just Play-Doh or the slime, something to
Yeah.
really get you back in touch with reality, right? So that's such a good suggestion. So my next question for you, I know that this is on a lot of people's minds. I feel like this year has really brought mental health to the forefront with COVID-19. And how has it affected your mental health? Because I'm really struggling. I stay home most of the time. I hardly go anywhere. My husband and I have high risk health conditions, and so I I know what it's like. So how has it been for you?
Absolutely. I think this year has been a struggle for everyone. I don't know a single person that can say they got through this year without any kind of mental health detriment. I've been home for most of the year. I actually am recovering from heart surgery right now, so I'm not really allowed to go out and do anything. My boyfriend has to leave for work, and so he's gone throughout the day, but he comes back, and he's pretty much my only contact throughout the day other than calling my best friend, and that has been a struggle. Um, I am an introvert, and even when you love someone, you can't spend 24 hours with them. So yeah, no, I have definitely felt the struggle this year. I think I am a big fan of what I call serotonin farming. So I like to go out to the movies by myself. I like to go to a restaurant and sit there and have a piece of cake and just enjoy my time. You know, I'll go out to a coffee shop and just get a cup of coffee and sit there for 30 minutes alone, enjoying myself. And none of that is available anymore. So, yes, that has been very difficult. But I think it's really proven to me that having your close structure, having your friends, and being able to communicate with them about those struggles has been so, so important. I mentioned my best friend, and basically, we both contacted each other and were like, we can't do this anymore. We love our spouses, but they can't be the only person we talk to anymore.
Yeah.
And so we actually will put each other up on video chat and just kind of go about our days. And it's nice to just have another person that you can check in with, that you can talk to, that you can like have be there while you're struggling, and you can help them and they can help you. And that has meant so much to me.
Well, that's awesome. That really ties in with my next question for you about having a good support system and how important that is. So it sounds like your boyfriend's probably also very supportive for you,
Yes.
and that's really important too. So if you didn't have that support system, how do you think that would affect you?
Ooh, uh, I would say that would be a very different life than what I have right now. I have known my best friend for almost 13 years now. I met her right after my first traumatic event. And so she's really been there through everything for me. And so I don't think I would be the person that I am today without that support structure being there. There are times when my depression gets super, super bad, and, you know, dealing with suicidal ideation and those sorts of things. And I always know that I can reach out to my boyfriend, I can reach out to my best friend. I have a very close relationship with my father, so I know I can reach out to him. And I always have those people to fall back on when I feel like I'm not enough to handle the situation anymore. I think it's really important. I know it's a huge struggle in the mental health community, but I think it's really important to have a therapist who's also someone that you feel confident in falling back on when those sorts of things happen. Um, I've absolutely gone through the gambit with therapists as well. You know, you see them for a while and you feel like you're not getting better. And so I will leave them for a little bit and then go find another one, and, you know, that sort of cycle. And
Mm-hmm.
I've kind of reached the point where I found a therapist who is someone who, when I'm really feeling bad, I can text him and say, hey, I'm having a real struggle day. And he'll be like, okay, let's go through a couple things. let's get collected, let's redo this. And so I think having that kind of professional support is also just extraordinarily important. And it takes a lot of trial and error, and it can kind of feel at times like you're not going to find that person, that magical, fairy godmother therapist. But I think they do exist out there for each person. And the thing about therapy is everybody needs something different. Everybody needs support in different ways. And so you kind of just got to try every therapist until you find the one that fits you and your life and your needs. And so, yeah, I think that support is really, really important at this time.
Yeah, absolutely. And what you said about therapists and your family and friends is so true. I go to therapy every week, and so I've definitely been through my fair share of psychiatrists, therapists, different professionals helping me, and it's always at a different part of my journey, whoever I need at that time. Sometimes maybe it's not the person that I needed, and then you just try the next person. I've had little gaps in my treatment with mental health professionals, but I've gotten a lot more consistent, and that's definitely what I need,
Yeah.
especially right now. So,
Oh, yeah, absolutely. I totally understand. I have struggled with that. I've had years in between therapists sometimes, and looking back on it, I can see how that was so difficult for me, how those times I thought that that was the better option. But looking back, I'm like, wow, I really could have used some of that support right there. So yeah, I fully understand. I currently am doing talk therapy, which is the most common form of therapy. I have previously in the past done EMDR, which is trauma-based therapy. So basically, what I was trying to get across is that I think a lot of people kind of hope the first therapist they see is going to be the end-all be-all for them. And finding your therapist, like your perfect dream therapist, is such a longer process than that. And I just hope that, one or two bad experiences with therapy doesn't make people kind of just brush it off forever. I have definitely given it a break for chunks of time. There have been times when I haven't had a therapist for a year, and suddenly I realize I really need one again. But I'm really, really lucky and really blessed that I have found my perfect therapist, and we're able to communicate and effectively, and that, I don't know, I finally found that therapist who is that support system that I needed. And he's willing to work with not just myself, but there are times when he talks to my boyfriend and is willing to try to get my point across because I can't, and that kind of thing. So it's just trial and error until you find the right one. And I get so discouraged when I have friends who, finally decide that they want that help for their depression or their anxiety, and they see a therapist for a month and it makes them feel worse, or it doesn't feel like it's helping them, and they get so discouraged. And I've been there. I have absolutely been in that exact scenario. But I just hope that they'll take a little bit of time for themselves and try again.
yeah, I'm so glad that you found a good therapist. That can make all the difference in the world. And as you mentioned, there's good ones and bad ones, or just ones that aren't a good fit for you. So,
Yeah.
so my next question for you is, what are some healthy ways in which you deal with triggers?
I would say for me, like I said previously, it's a lot about warmth for me. I keep my house warm. I keep a lot of blankets around. I like really comfortable clothing. I am a person who likes distractions. If I am triggered suddenly, I like to kind of be able to just step away from that scenario. So I leave things all throughout my house to be able to distract me. I have Play-Doh and like kinetic sand and little fidget toys, and I kind of just stash them throughout my house. And randomly, as I'm doing things, if I start to get stressed out, there's almost always one within arm's reach of wherever I am. And that has been a huge help for me.
That's really great. And then just one more thing. What is one piece of advice that you want someone to take away from this interview?
Um, I think be open, honest, and just keep trying. I know that it can get embarrassing talking about the same things over and over again when you have to find new therapists, but just that perseverance, really, you'll find that place someday where you're supposed to be and get that support that you need. And being open and honest about the medications that you're taking and if they're working or not working. There have been times in my life where I continued to stay on a medication that wasn't working because I was just too embarrassed to admit that it wasn't working. And really, that openness, that honesty with your providers and with the people who are trying to support you, you'll be able to get to a place where it can really change your life. And I think a lot of the negatives make people feel like that's the end. Like they tried that med and it didn't work, so that's it. But there's always another one. There's always something more to try, I promise.
That's really good. And thank you so much for sharing with us today. Your story is really inspiring, and I know that I learned a lot from you. So thank you so much.
Of course, always willing to listen to other people and try to get my own story out there for them.
Yeah, thank you.